Good afternoon. My name is Pearl Sanchez, and we're discussing the integumentary system today. There are various layers of the integumentary system as well as structures. The main membrane we will discuss is the cutaneous membrane. However, there are other accessory structures which we will touch on as well. There are four tissues that make up the various layers of the layers of the integumentary system. We have the smooth muscle tissue, we have epithelial tissues, we have connective tissues, and nerve tissues. So under the cutaneous membrane, we have two categories, if you will. We have the epidermis and its set of layers, and we have the dermis. The epidermis is going to be the layers closest to the surface of the skin. So we're going to be discussing them from the surface and then going down from there in terms of the groupings. Okay, so the epidermis, the layers include the stratum basale, stratum spinosum, stratum granulosum, and stratum corneum. It also has a stratum lucidum, I believe the term is, and those are seen more in the palms or the heels of the foot. So the dermis then goes further interiorly from there. The dermis consists of two layers, the papillary layer and the reticular layer. The subcutaneous layer is inward still, and while it's not technically part of the integumentary system, it is discussed when discussing the system as it is often discussed in terms of the skin. So we have the subcutaneous or hypodermis layer that is below there. The accessory layers include, the accessory structures include hair follicles and hair, exocrine glands, which include oil glands and sweat glands, and the nails. Just looking at my notes here. So an example of a clinical application in terms of the skin would be shock and the symptoms or indicators of shock that you can observe through the skin. One such example would be a pale skin. If the patient appears to be going pale or comes in abnormally pale, of course. And that is an indicator of slow blood flow, which of course can be a symptom or indicator for other issues, not just shock, of course. Another is blue veins. I've seen the blue veins more prominently, easily, and that is also, is also a indicator of shock, as well as potentially other things, of course, but specifically with shock. Blue veins indicate a loss of oxygen, and that is one of the symptoms of shock. There are several others, but these are the ones in terms of the skin. Same thing with, to go along the terms or the lines of pale skin, to the touch, if when we're touching that patient's skin and it turns white and it's the normal pinkish color or the normal skin tone, it's not coming to the surface as quickly as it should or as it normally does. It's an indicator again of the blood flow being decreased or slowed, which of course is an indicator of a heartbeat, a problem with a heartbeat, or heart problem. And like I said, specifically talking about shock in this case. So that is a very quick, slightly over description of the integumentary system. I hope that suffices, and thank you so much. I'll see you next time.